After more than 2 years of the pandemic, the CDC is updating its guidance for COVID-19. It comes as COVID cases are on the rise here in the Piedmont Triad.
Yeah, things like staying 6 feet apart are no longer recommended, along with quarantining if you've been exposed to the virus. WFMY News 2's Avery Powell got answers to some of the most asked questions about this new guidance.
The CDC says these new guidelines are not saying the pandemic is over, but that there is more information to better understand and live our daily lives with the virus. All of the new guidelines apply to both vaccinated and unvaccinated people. We looked at some of the top questions people searched online for COVID right now and asked an infectious disease expert to break it down. What happens now if you test positive for COVID-19? The CDC says first, isolate and wear a high-quality mask.
Isolate for 5 days. If you're asymptomatic or very mild, at the end of that 5 days, go back to your regular activities. You can take your mask off after 10 days or with 2 negative antigen tests.
Those tests should be on the 6th and 8th days of your isolation. If your symptoms come back, restart isolation. What about being exposed to someone with COVID? The CDC says you no longer need to quarantine. Just wear a high-quality mask for 10 days and get tested on day 5.
What I hear from the government is that there is an expectation or an understanding that COVID is with us now.
But what if you were just exposed to someone who was exposed to COVID?
My advice has always been, don't worry about that exposure until you definitely have a positive from that person who you were exposed to, or if they're sick. If they're sick, then be concerned and go get tested.
One thing that's not changing, the push for vaccinations.
The people who are in our hospital, only 30% of them are vaccinated. So there's really strong evidence that being vaccinated keeps you from getting a severe illness.
And Dr. Hatcher with Cone Health said to be on the lookout for new booster shots coming out this fall that will offer better protection for the new COVID variants.